Hi, my name is Pierre Langevin from Cortex, Medicine et Readaptation, talking on Series 2 on what we are doing in our clinic to assess and treat concussion. A clinical interdisciplinary approach to concussion. The term interdisciplinary here is the key word to define our approach at Cortex Clinic, and I'll explain you why in the next few slides. In the next 3 to 5 years, to answer the question asked here, we'd like to see more evidence on efficacy of emergent treatment approach for concussion. We'd love to have more clinical tools for the assessment and treatment of concussion developed by the researchers. And finally, we'd like to see more research on prevention of concussion in kids. So my name is Pierre Langevin. I'm a physical therapist. I'm clinical professor at Laval University and co-owner of Cortex Medicine Readaptation. I'm a clinician at Cortex Medicine Readaptation too. I'm doing some research mainly on neck pain and concussion with my colleague Phil Fay. In the Cortex Clinic, I'm a small piece of the puzzle there. So I'm working with a big team, representing a big team today to explain you what we are doing in our French community clinic in Quebec City. So this is a graphic representation of our clinic with the patient in the center, in the middle, with all professionals around. So we have physical therapists that are working with patients. Some are doing vestibular rehabilitation, and some are doing more musculoskeletal rehab. We have athletic therapists and kinesiologists. We have neuropsychologists, and we have physicians. So all these people are working with the patient and his family to make kids doing better. So here you can see the clinical pathway in which kids go through when they consult our clinic. So we are treating kids mainly between 12 and 18 years old, but we are beginning to offer services to younger children now. At the first assessment, kids will see neuropsychologists, a physical therapist, and a physician. And according to their recommendation, the kids will have a deeper neuropsychological assessment or motor cognitive assessment or more physician assessment or physical therapy assessment. I'll explain the role of every clinician later. And then we are measuring the outcome, and then when the treatment goals are reached, there is a return to cognitive first and physical second activities and participation with a protocol that we have developed. So here are the role of every clinician that are working in our clinic. So the neuropsychologist is doing the first assessment and basic recommendation according to latest guideline. He's doing more deeper and more longer and more complicated neuropsychological assessment. He's doing management of cognitive and daily living activities. So by a lot of recommendation, a lot of coaching, management between rest and activities. He's also doing return to school recommendation and doing the follow-up with the school, with the people in the schools. Also, physiotherapists here, physiotherapist assessment and rehab. So all our physiotherapists are trained to treat cervical and craniocervical joint dysfunction and muscle dysfunction. We are doing assessment of cervical and craniocervical joints and muscles. We are doing oculomotor assessment and rehab. We are doing vestibular balance, so we have a specialized vestibular physio that are doing assessment and rehab, and we are also treating temporomandibular dysfunction when needed. We also have a cognitivomotor therapy that is done by a certified athletics therapist and a kinesiologist. So our cognitivomotor therapy is kind of new name. So the role of these therapists are to make the link between the brain and muscles and muscle control. So here is doing an assessment of balance and rehabilitation of balance. So there's a bit of overlap between the vestibular balance physiotherapist and cognitivo-motor therapist. However, our clinicians are working together. The cognitivo-motor therapy is doing dual task rehabilitation, doing cardiovascular training to help more subacute and chronic kids to heal better, and our cognitivo-motor therapy therapists are doing the return to sports according to the latest guideline of return to sports. Our physician is doing a medical assessment, of course, doing treatment, so prescribe medication if needed, is doing a wrap-up of the recommendation of the whole team, and is doing his own recommendation. He will do also prescription of special tests if needed, and is doing the follow-up of patient when the patient goes through the pathway that you've seen before. So the interdisciplinary work is our main strength. We are doing team meeting every 2 weeks to talk about patient. The different role of each clinician ensure that every component of the concussion is covered in assessment and in treatment. So as I said before, the screening by and the treatment by the physical therapist with the cervical spine, vestibular, oculomotor function that are assessed, the neuropsychologist's role, the physical activity, gradual physical activity that is inserted in the way through to recover, the balance training, and the dosage and coaching of patient around their activities and participation is a key here. And we always return kids to learning gradually before return to sports. Barriers. Communication and follow-up with the school is not always easy. However, in one school with which we are working, we help the implementation of a special educators there. So this educator is communicating with us closely, and this is very helpful to help schools to understand our recommendation. Also, our approach is a bit time consuming for patient and clinician. It is costly. Our services are private, so even though our services are covered by private insurance, it's not all patient that can afford these costs, and we have some difficulty to find good and experimented clinicians who are willing to integrate the teamwork approach, and concussion is new, so there is not a lot of experimented clinician out there. So we hope that guidelines created after the symposium will help clinicians on how they can act differently with different age group among young population. So clinically we found 0-5 or 6-12 or 12-18 years old population are showing very different clinical presentation. It will be useful to have different recommendation according to such a classification. We will certainly want a return to school and to sports guideline for different age groups, and assessment and treatment guidelines that include assessment and treatment recommendation of MTBI associated impairments, like what we are doing with the C-spine, vestibular system, oculomotor system, and all impairments around the concussion. Thank you to the organization of the symposium who let me talk about our clinical approach. Hopefully it will help the group to move forward. In our view, concussion should be seen with different pairs of glasses. So a lot of professionals is now involved on the field to help children with concussion, and our interdisciplinary clinical setup is an example of that. Unfortunately, I'm not here today to answer your question, but I'll be glad to answer every email I'll receive if you have questions. Thank you and have a good day.